Hi, this will be Chapter 6 in Law and Ethics. It's ethical decision making in dental hygiene and dentistry. So what you're going to learn in this chapter is to describe the difference between an issue of right and wrong, a simple right and wrong, and a true ethical dilemma. You're going to be able to identify the goal for use of an ethical decision and making process. You're going to be able to see and list the 6 steps provided in the ethical decision-making model that we can all use to discern outcomes of ethical dilemmas. List and discuss the categories of common ethical dilemmas that hygienists face. And apply the decision-making model to a hypothetical situation. So the first thing is ethical dilemmas. 2 aspects are involved in ethical decision making. The 2 aspects involved is the ability, we have to have the ability to discern right from wrong, and which means you need to be able to tell the difference. You need to be able to recognize it, become aware of it, and that you are able to know right from wrong to begin with. And secondly, once you know that, you need to make a commitment to act on the decision. So, as Confucius said, to know what is right and not to do it is the worst cowardice. So we feel that way here. If something is going wrong and you discern that your dentist or another colleague is maybe your colleague, which is a hygienist, is working impaired, and you know that they're impaired, but you're friends, you know she needs her job, you don't want her to lose her job, and so you act like you don't know anything about it when you obviously do. Number one, it's admirable to take your friend's position and back them up, but you're actually allowing there to be possibly unsafe procedures and with the public, and which can also later affect your practice. If people know that and know that they're allowed to work there, it can affect everybody's, which will affect your job and reputation as well. So you have to really think about this. If something is going wrong with a colleague or the dentist, you would want, first of all, to not knee-jerk. You would want to talk to some other colleagues, call the dental board, call Beckerly or Thurlow or me, or you can call us long after you graduate and say, I've got this problem and I don't know what to do. And between one or all of the above, you'll be able to work in a more positive way around this situation. So, but first, before you can even do that, you have to have an awareness of ethics and what is right and wrong, according to our codes and even legally. So if you act like you don't know what's going on when you do, as far as the law goes, if it's something illegal that they're doing, you're condoning it. You might as well say that you're condoning what they are doing because you know what they're doing is wrong and you're not acting on it. So ethic dilemmas, when you're deciding on something, you have to be able to tell what is right and wrong, and then you have to make the commitment to act on that decision. So the learning ethical decision making, it's very challenging. Often there's no one clearly correct answer. There may be several answers and you still have to come up with one. So what this chapter is going to deal with when we get further into the chapter is kind of having a model of questions to ask yourself and things to work out that can help you come to a decision that is the best way that you can do that. So professional, social, and economic pressures may be in conflict with your values and principles. Just like I was saying, the professional socialness of your friend, or maybe it's a boss that is doing something unethical, and you know very well you need your income for your family, and you don't want to be known as a squealer. You don't want it to get around to all the offices, but you have to say something and stand up, or when they do get caught, you're as good as condoning whatever they did because you did nothing. So it can be really challenging if that happens. Luckily, it doesn't happen to that kind of a serious degree in most offices, but it does happen in some offices later on in the course. I think on the maybe on the day of your midterm, I think we're going to go into the state laws and Missouri state laws and look at more clearly the Kansas state laws according to the dental board and of each state. And I'm going to show you how to get into some sites that will show you what dentists and what hygienists have been had their license taken away or have had their license revoked, and it will clearly, once that's in a log, as long as you know where to go to get it, it's up in the public for years and years and years. So it can be a daunting process. So ethical decision-making models can be helpful in trying to hone down what exactly you should do. The ADEA stands for the American Dental Education Association. And the Educational Association realized the importance of ethics in the student curriculum. And so they decided years ago to incorporate ethics. When I went through dental school, we did not have an ethics class. We had some little ethical questions here and there in other courses, but they were just here and there, and we kind of hit on some, didn't hit on a lot. But as the years rolled on and people were, there was a lot of like, I didn't know that and all this stuff. So they started incorporating ethics into the curriculum. And in fact, just like a couple years ago, I want to say 2 years ago, Kansas started requiring, if you have a license in Kansas that you want to keep renewing, you must, you have to have X amount of, like it's 30 continuing ed hours in a 2-year period. So one of those hours, at least 1 hour, one course has to be in ethical and ethics. And so that way they know that people are keeping up with knowing the laws, and it makes people more accountable. So Missouri did not require that, likes it, but did not require that as of yet. I'm not sure if they have. Usually it takes a while, but Missouri tends to follow Kansas after it's out a little bit. So I wouldn't be a bit surprised if in your career time, Missouri starts requiring that in their continuing ed also. So the goals of to have this in the ethics in your curriculum is, number one, to develop a commitment by all the students and later graduates to moral principles that are the basis of the profession's contract with society. So it's at least an hour that you need to take to remind you and refresh your memory sometimes on this, rather than to just study it in school and then kind of never hear about it again. So the second goal of the American Dental Education Association in putting this into the curriculum in Missouri and Kansas and kind of everywhere is to really stress one more time how important it is for lifelong learning, that you don't just stop when you graduate, that this is through continuing ed courses. It's a learning process, and you'll always be learning, not to the degree that you are when you're in school, but that you doesn't become stagnant and that you will keep moving forward. So, ethical awareness. We talked a lot about so far in this course that we've had these chapters. We've talked about ethical dilemmas. And now we're going to talk about ethical awareness. We're going to talk about moral issues instead of just ethical issues. A lot of times they can cross over, but we're going to talk more about a moral side versus the ethical. So a moral issue is response to ethical issues depends on your moral sensitivity. So if you are a person who is not aware of different categories and what moral problems could be, then how are you supposed to be able to decide really some hard decisions that you might need to make with ethical issues? So we're going to kind of back up. As you can see, they wait till chapter 6 to go ahead and go through this, when it actually, I think it should have been, these chapters should have been more 1, 2, and 3. But the first one is like the category. There's moral weakness, there's moral uncertainty, there's moral dilemma, and there's moral distress. And you need to know, you'll have quiz over which one is which. So let's look at moral weakness. The category of moral weakness is they may state it on a test as moral responsibilities conflict with personal inclinations. Sometimes they'll have it on in review books that your moral responsibilities are going in one direction and your personal feelings are going in the opposite direction. That's how they state this. That all has to do with moral weakness. So if you see that, then you will know. What it means is your moral responsibility. Let's say that you're in your practice and you have an hour for patients, and you're 11 o'clock to 12. You have lunch at 12, from 12 to 1, and everybody's going out that day. And they're going to, as a team, and you're going to go out to some quick restaurant and have a lunch together before your 1 o'clock patients, and everybody will come back to the office. So as luck would have it, your 11 o'clock shows up 15 minutes late, and you're just about to tell them you'll have to reschedule when your dentist comes out, kind of like, can you please take them? And so you'll go ahead and see them, and so everyone else is finishing up and you're running late. So maybe your dentist goes in and kind of does his or her exam and leaves with everybody else, says that they'll save a table. They whisper this to you, that they'll save a table, and you can go ahead and come when you're finished. So you know that all that you maybe have left to do is that the patient asked for some specific home care demonstrations on how exactly to floss their teeth and how exactly to brush. And so you show them yourself, and then you have to give a mirror to them and have them try to duplicate what you did. And anyway, this is all taking time. And so instead of that, your moral responsibilities would be to stay with your patient. And if you don't get to go to the lunch, oh well, and if you have to come in late and only stay 10 minutes, oh well. that your moral responsibility should be toward the patient. So, but your personal feelings are, I have worked really hard and not had a break and never been to a lunch and blah, 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 and you're starving and you want to go for social reasons also. And so you decide that you're going to give your patient a really cheap explanation, and just show them a little bit of the home care so that you can basically get them out of the office and that you can run on to where you want to go. That's called moral weakness, that you're having a weakness moment because you're letting your personal issues compete and win over what you know your actual responsibilities are. So they're in conflict. So moral uncertainty. This is where you're going to question as to whether a moral obligation from you exists at all. So moral uncertainty, an example of that would be you've done 4 quads of SRP. So it's taken at least 4 weeks to complete the SRP. The patient heals and you tell them all these things to do at home before they come back in a month, and then you can see how they responded. And so they wait the month, and okay, so the month goes by and they cancel that appointment for a good or bad reason, doesn't matter, they don't show up. And so at 5.5 weeks, you see that patient. Number one, that's just time enough for them to have gathered a lot of bad bacteria. So you're not going to see, maybe quite as good of an outcome as you did if they'd come in 4 weeks. But a lot of times, anywhere from 4 to 6 weeks is acceptable. People do have issues. But they did not, you see them and they didn't do a thing, and they laugh sheepishly and they put their head down and they say, I'm sorry, I know that you told me to floss, and I know, but I'm just so busy and I forgot to floss, and how much have you flossed? Well, some weeks maybe twice a week and some weeks not at all. And you look at their gingiva and it's swollen and puffy. And in other words, you've done your part, because it's a duo activity. It takes the hygienist and it also takes the patient to do their part. So they didn't comply with what you told them to do to have a good outcome. And in fact, it's not a good outcome. So you're feeling really badly because all of your SRP, you have to explain to them that maybe they need a retreat. And in private practice, they may have to pay for that retreat. In our clinic, if it's that quick, we don't make them pay another $30. In private practice, you're talking about maybe over $1,000 to do all 4 quads. And so you feel so badly, and really you have no reason to, because there's a huge question whether you have a moral obligation to them at all. You did your part, they did not do their part. So it's a question of how much, blame that you should take. Maybe you'd feel guilty that you didn't impress upon them emphatically enough or whatever, but that's called moral uncertainty. So moral dilemma is when obligations and responsibilities are in conflict. So we have an obligation, in other words, to, it could be like an ethical dilemma and a moral dilemma. Actually, our obligation is to try to save somebody's teeth. Our obligation is to make sure that our patients are healthy and have the best of health, but they're begging you. I know they needed a pre-med, but they don't want to, like we've said before, they don't want to drive back all the way back after they've had a pre-med. And your obligation says that non-maleficence, and that we're not going to do any harm to the patient, but our responsibilities say another thing. Okay, so when your obligations and your responsibilities are in conflict, about it could come to a moral dilemma. So moral distress, what is that? Moral distress, think of distress and frustration at the same thing. It's frustration that you're going to feel, or you may feel as a dental hygienist, but it's perceived from you feeling powerlessness when what is happening appears to be wrong and you are unable to act ethically. So you know that the doctor is uh, cheating on what he's claiming, that the X-rays that he's claiming on taking on a patient, and you know that he didn't take them. Okay, so you feel powerless because you're the employee. You need your, if you get him into trouble, not only might you be blackball, he could blackball you through the industry and say whatever he or she wanted, but also if he gets shut down or suspended, you're out of a job and you're out of a paycheck. So you feel it's what happens with moral distress is that you can also kind of develop an ethical dilemma out of it. It's not, the act itself would not be an ethical dilemma because what the dentist is committing is fraud. I mean, you wouldn't have to try to make up some kind of a program or a model and say, ask yourself all these questions. It's flat illegal. So that's not the part, but the part that could become a moral dilemma, or I mean a moral distress or an ethical dilemma, is that ethics tells you to do something. It's illegal, it's against the law, there's nothing about ethics, but as far as you possibly losing your job, it could be, how do I say this and how do I do it and keep everybody happy and keep, if he goes down, all the other employees are going down too, kind of a thing. So you can begin to feel powerlessness and it puts you in a state of moral distress. If you know that your dentist is not really sterilizing things for long enough or in the right way or something like this, you may feel powerlessness. It's going to put you in a lot of distress because you know something appears to be wrong and you can't act on it ethically. So these are examples of weakness, uncertainty, dilemma, and stress, and you'll need to know those. So here we go. This is just another, some more examples of the same thing. Let's go to, let's say moral dilemma might be bioethics, matters of life and death. And that's really what the moral dilemmas, ethical dilemmas are more about the ethics of it, and the moral dilemmas can be kind of ethical, but it really deals more with matters of life and death. A moral dilemma may be, do I take my husband or wife or mother, father, whatever, off of life support? This puts me in a moral dilemma because I do not believe that morally that we have the right to judge when somebody is going to die or not. That's in God's hands. But you know that if they live, they are not going, they may be in a vegetative state, they may never come out of a coma. Nobody, you're going to put everybody in bankruptcy and the whole family, all the adult siblings or what, your own family, and trying to keep this person alive when they're not going to have any life, really functional life to them. And so that's more morally, the moral dilemma of a life and death issue. So moral distress, and maybe another example here is treatment recommended by another provider for a patient is deemed excessive or unnecessary. So you are going to say, it could either be by your dentist or another dentist that they've gone to. Like, you'll have a new patient, they've moved to town, they come to you, and you look in their mouth and you see, it's filled. Every tooth is filled. They have all crowns everywhere. And they show you, they bring their last year's x-rays, and you can see before they had these crowns, and you see like either nothing wrong with them or very little tiny spots, and you know that what happened is that dentist probably said that they needed crowns to get the money, but they didn't really need crowns. So it's when and you are kind of unable to act about it. Maybe it's a dentist in a different town or whatever, or state or whatever, and you're going to feel moral distress. And if your own dentist is doing something like that, you're going to feel even more moral distress. So this is experienced when an individual cannot do what is right because of a system value issue. Maybe it's resistance of a powerful person, or restraint in the situation. So that would encompass moral distress. So the 4 A's. The 4 A's are: you ask, you affirm, you assess, and you act. So to rise above it, you need to ask about the distress, showing any signs at work. You affirm the professional obligation to act. You know that you're supposed to. You assess the situation, identify the sources of distress, then you're going to analyze the risks and benefits, almost like a pro-con list. And then you have to act. You prepare personally and professionally to act. So maybe after you've had enough distress, you have finally are at the breaking point, and so you begin to say, I've got to either act on this, I've got to leave and then act on it, or whatever. But it may encompass you getting hold of calling the dental board and helping with an attorney and giving you facts or whatever. But those are the 4 A's and how you can rise above the moral distress. First, see if what you're distressing about is even real. Is it a real issue, or does it just look like this is what's going on to me, but it's really not? So you need to kind of decide those, and having these kind of questions can sometimes help you come to that conclusion. So ethical decision-making checkpoints. You're going to evaluate the circumstances. You're going to determine what moral values and ethical principles are at risk, or even if they even are at risk. You're going to ascertain what principles need to be expressed and defended and what really don't. You're going to consider the possible adverse consequences or risks associated with you taking action on this. You're going to, once again, almost like a pro-con list, what are the possible consequences? If he goes down, is everybody else in the office going to lose their job and hate your guts forever? And the risks of pitted against the risks of being unfair and untruthful, unethical, illegal to your patients. So you're going to, that that's going on in your office. So then you need to assess whether or not the adversity at hand can be endured. Maybe it's something that, well, it's kind of on the fence that they're doing such and such, or whether it cannot be endured. And something like fraud you'd not be able to endure that. You couldn't know it and then just sit and not do something about it. So you want to avoid any stumbling blocks. And so in making some kind of a patterned list this way, it can help you decide whether the issue is something that is irritating but can be lived with, or if it's something that's just flat wrong. So we always continue to, and throughout your career, hopefully you will continue to develop moral courage. And in that case, it would take a lot of courage to act. So this is the ethical decision-making model that they have. So the most critical step, I'm pretty sure on the midterm, or at least on the final, about the most critical step in ethical decision-making is first identifying the problem. Do you have a problem? So if your problem says, I, if it's fraud or something, it's maybe an ethical problem, but it's not a dilemma. There's no dilemma. The law needs to be informed. But first, you're going to collect all the information. So you collect all the information that you can about what you think the problem is. So if it comes to be just the fraud, you can stop this whole model making because it's just flat wrong. You don't have to sit and make 6 steps of whatever. You're still going to come down to the fact that it's against the law. So, but let's say it's something else. Let's say it's something else in the office where you are going to, maybe it has to do with your work or your coworkers. First of all, you want to collect information and make sure that you are you're clear on dates and issues that things are happening or whatever. Then you're going to state your options. So you're going to collect all the information and then you would state your options based on the fact that I know this happened at such time. It happened multiple times. It happens, with this issue, that issue. Then you're going to take all that information and you're going to state options. Okay, based on this one thing, if I said something, what are my options about this? What would my options be about this next piece of information? And so then you're going to apply, you get your options, and then you're going to apply the ethical principles to those options. So you're going to go back to non-maleficence, beneficence. You're going to see which ones on the hierarchy take precedence over other things. And so you could say, it might be a situation that you keep coming back and saying they breached the principle of non-maleficence in all of these situations. So it is non-maleficence. They promise not to do any harm and they're doing harm. And so once you've identified, collected all the information, stated your options about each one, applied ethical principles to see if you could even apply ethical principles to it. And if you can't, then maybe that's not a real ethical problem. But if you can apply ethical principles to those options, then you know you're headed in the right direction. So once you do that, then you need to make a decision with all that information and pros and cons and consequences and risks, and ethical principles applied to a particular issue. Then you've got to make a decision. I'm going to tell, this is how I'm going to tell, I'm going to inform, or I'm going to have a talk with this person, this is what I'm going to do. You make the decision of whether it's can be lived with or not. If it's a true ethical dilemma or not. And then that's not good enough just to make the decision whether it is or not. The final step, and what makes all the difference in the world, is you have to implement that decision. So you can't make the decision, and then if you chicken out having that talk with your dentist or whatever that fellow hygienist or person, any person that's in the office, you have to implement that decision before you can close it out. Just making the decision is not enough. Okay, so the most common ethical dilemmas, and we're going to switch back to ethical dilemmas here. and not moral ones that are faced by dental hygienists. There's a lot that are faced, and I think if you look in your book, it lists a lot. So substandard care is the first one and the biggest one. Substandard care, it could be that you're giving substandard care as far as infection control, or you know someone in your office that is not using good infection control, etc. And so therefore they're giving substandard care. They have a failure to refer and non-diagnosis of a dental disease. These are the three things that the dental board gets called upon when people are turned into the dental board. These three first things under substandard care have the most issues. Infection control. Your dentist will refuse to refer them to a specialist that they need to go to. And non-diagnosis of a dental disease. You didn't look in the mouth or under the tongue. They wound up to have, for an intraoral exam, they wound up to have little spots on the underside way in the back of their tongue that turns out to be cancer, and it was a fast-growing cancer, and now they're going to lose half their tongue being taken out because you didn't see that there was a little something there. And believe me, they will go back. Once these things are diagnosed, they know, depending upon the type of cancer or whatever that it is, how long it usually takes for them to develop. And if they figure, like, didn't you go to the dentist in between that time? The dentist or the doctor? Well, the doctor just kind of looked to see if for 2 seconds, I said, "oh," and to see if my throat was red. They didn't really look around my mouth, and my hygienist never does that. Okay, so they had a dental disease that you did not diagnose. You didn't see. So those are that's substandard care. And those three are the ones that they get complaints about. Then next would be overtreatment, excessive and unnecessary services. So whether a person is, wrongly influencing their patient's care treatment decision as a result of acting like you're in a position of greater knowledge. Okay, so that's overtreatment. Scope of practice. Legally assigned scope of practice is exceeded by an RDH or a dentist or another member of the dental team. So someone is going beyond what legally it says that they can do. All right, so the dentist is allowing an assistant who has not taken a course even on it, but is allowing an assistant to scale underneath the gum tissue, underneath the gingiva. Illegal. Okay, so sometimes they do it. And you have fraud. Insurance claim or other reimbursement mechanism is adjusted to favor the office or a patient's financial situation. Could be other types of false charting or other cost containment efforts. So sometimes it's not a real thing based off of the x-rays because they tell no lies, but they will sometimes, with some insurance companies, you have to send in a copy of the perio chart, and maybe you decided to put a few more 5s and 6s in there than there really were, and so that you could get an SRP, one more SRP, because your office, you're on commission, or they have a bonus. They're going to give a bonus for the more SRPs that a person gets that month. And things like that are supposed to motivate hygienists to really be looking if a person really does need one or not, and not just to haphazardly just be in there cleaning and polishing people's teeth and letting them go, but to really look at the situation and make the right decision. Unfortunately, what it also causes on the flip side is for hygienists to want to need that bonus money, and maybe they start fudging a little bit on the numbers. Okay, so that's insurance fraud if they ever catch it, which is illegal and can, on the dental side, can cause you to either have your license revoked, or it can, or suspended for a year, or whatever they deem a monetary ball that you'll have to pay the courts. And then you go to the law side. You may be imprisoned with another monetary fine. So confidentiality breaches. It's a situation where a patient or a child's confidentiality is jeopardized, or the need and requirement for informed consent is not met. So someone speaks another language and you needed this patient, you're anxious to get home, and you said, well, they kind of spoke English, and so you just acted like they really understood what you were talking about, and you were going to start that day, so you just whip out your anesthesia and go ahead and start. That would be informed consent that was not met. Impaired professional, a dentist or a hygienist or other team member cannot or should not perform dental care due to their dependence on alcohol, drugs, or other substances. There's sexual harassment, a wide range of behaviors that a dental team member may observe or be subjected to that can be classified as harassment. So if your dentist is having a fling with one of the other hygienists in the office or anybody else in the office, and you are just observing this situation, or let's say that the hygienist next to you is young and new and single and kind of a partier, and so is always joking around with the dentist, and the dentist starts like slapping her on the butt or starts doing something sexually with them that really, and maybe the person does not go for it. You know, the hygienist is, I may be these things, but I'm not your sex kitten type of an attitude. So you're observing another team member using kind of sexual harassing ways. So abuse. Situations in which abuse of a child, elder, or spouse is observed or suspected. So they do have legal requirements, or as well as ethical considerations in most states. You'd need to kind of make sure that you knew what you were talking about, had a certain kind of proof. You write down everything that you would know about that situation, try to kind of figure out pros and cons and risks and all of that before you would confront that kind of an issue, but hopefully it wouldn't take like real long. So here's again the 3 most frequently encountered practice dilemmas: infection control procedures, failure to refer patients to a specialist, and a non-diagnosis of a dental disease. So in summary, ethical choices and dilemmas can be expected by healthcare professionals. They hopefully will not be happening all the time. I didn't have any over a 10-year period. I really can't say that there was an ethical dilemma that I saw of anything in the office. I did have some moral weakness a few times of really wishing that I could finish my patient super quick so I could go join the office either after work or other times. Of which I always stayed, but it was hard to act like that's what I wanted to do because inside I was not happy about it, but I went ahead and gave the best to my patients. Ethical decision making is something that can be learned. This is the other thing about ethics and why they put this course in curriculum. You're not born with morality. You're not born with knowing what's right and wrong. Okay, you're taught that. So ethical decision making, you don't just wake up one day and are a good ethical decision maker. Most people are not, but it can be learned. It can definitely be learned. So the use of an ethical decision making model can be very helpful. And this chapter now will go through a 6-step model that can provide structure and guidance. And put a few definitions in here. Ethical dilemmas, one or more ethical principles are in conflict. Moral dilemmas, a situation where one or more obligations and responsibilities are in conflict, mostly life and death issues. Impaired professionalism, someone who's not able to function due to illness or substance abuse, a professional